So what's all this mean for mental health providers? Virtually every professional association has released some guidance, some commentary around artificial intelligence. So depending on your discipline, you can probably find those pretty quickly with a search, or you can ask ChatGPT to summarize them all for you, should you want to practice with some prompting. When I think about clinical applications, I look at it on this continuum of indirect applications are those things that happen when the client is not present, and then direct applications, things that happen when the client is present. So starting with the indirect applications, as a clinician, I can see myself brainstorming and helping and using generative AI to help me do research, to jog my memory of things that I might have forgotten, or to give me some ideas that I might not have ever known about. And then I can fact check those resources. And I think this is a key ethical practice is I don't just stop with the generative AI output, much like I would not stop with Google output or any other output. I would test the veracity of that source, of the claims that are made, and I would come to my own decision about application. So brainstorming and researching ideas, I think, is one potential use. Something I'm researching right now, which I think there's a lot of opportunities in, is practice simulations. Think back to when you were learning to be a healthcare provider and you had to do these made up role plays with people that always seemed to lack something authentic and could never really give you the real experience that you wanted to. And we can't get, you know, this vast number of people to come in and role play with us. So, I think being able to simulate practice, especially with the voice interface of ChatGPT, I think is the best right now, but there will be others that emerge. So anytime you can use a voice interface to interact, I think it's really positive for the future of practice simulations. Imagine a world where, pilots have to have so many simulation hours before they go and ever get in a plane. I don't see a world where I can't require that many simulation hours of a healthcare provider before they get to work with real people. We learn by doing a lot, so maybe this is a way that we can scale up that simulated practice in a really cool way. There's a lot of AI software now to review your sessions, provide you feedback, can even provide you feedback in a certain modality if you want. Clinical documentation is probably one of the most common use cases. I know that most EMRs now are incorporating some automated note writing feature that then a clinician will verify, edit, etc. Most of those same softwares will give you an initial diagnostic impression. Again, remember that the clinician makes the diagnosis. The system might give you an idea that then you verify given your interview skills, your observation skills, etc. And to me, this also isn't that different from how medicine is practiced for decades. They give tests, they look at those tests, they interpret the results, they give the diagnosis. This may just be a different and a new kind of assessment method. Treatment planning, if you're just stuck in a rut, you've been writing the same treatment goal for too long and you just want to have a new way of doing it, or again, you're not familiar with an evidence-based treatment plan model for X, Y, or Z, you might as well give it a shot, see what it gets. Again, do your research, evaluate the veracity and the effectiveness of the output that it gives you, and then personalize it to yourself and the people that you serve. Think assessment ideas, you'll never know the number of assessments that exist on any topic. So maybe just getting an initial list of assessments that you might want to use, tests that you might want to bring in, and then again, evaluating those. I think outcome evaluation is another place. Most of the EHR systems now have some way to track outcomes, scores on different standardized measures. And depending on the type of telehealth, if there's any kind of mobile health intervention or patient monitoring system in there, all that data then comes back into the client record. Lots of concerns about that. Has to happen with consent if it does happen. But the ability to have all of that data there to aggregate and inference to help hopefully make sound clinical decisions, that's the only way I would want to use it. Again, I'm not saying you have to use it this way, not even saying that I would use it this way, but I think these are different types of indirect use cases that you might find. Moving on to the direct clinical applications, clients are going to be interacting with technology, social media, and artificial intelligence. So that might just be a baseline for where we start an intake sometimes. We want to know about, are they interacting with companion bots? And I think this is really where our skill will never be replaced. Because even if they're interacting with a chatbot therapist, I'm still going to ask questions like, what's it like to interact with your chatbot therapist? How does that relate to the work that we do? What kind of attachments are you forming to that chatbot therapist? There's always going to be a place for that processing of the human experience that they're having, even if it's in relation to a chatbot. So our skills still going to be used, just a different focus. I think there's a world where not only, and this already exists too, not only where an AI helps to generate a note or clinical documentation, but it actually is in the session taking notes, perhaps even in real time, so that then you can access what was it that you said earlier, and then the chatbot may be able to help you because it's been taking notes. Clients may end up using an in-between session chatbot that either you recommend as a clinician or maybe your practice offers to all of your clients. And this gives a way to increase therapeutic interactions in between sessions that you have with them. I see a world where there's a co-counselor, an AI in the room with you, and it just becomes a part of the session. It is another co-counselor that you can bring in or not based on the dynamics and the process of that counseling and how that might manifest itself. There's also a world where there's probably a digital twin therapist that people might create. So, imagine that day that you're triple booked and you send your digital twin to see two clients and you see the third. Not saying I would do this, not saying I want this to happen, but I am saying that it's a possible outcome of the technology. And then I think where we'll land eventually, not replacing the therapist, but I think we will land in this place of reimagining what it means to be a therapist. And, much like other technological revolutions have occurred, this is another one that we're going to have to think about. How do I interact with this technology in the context of real human life and interactions and the messiness of the therapeutic relationship? So this is where you're at right now, probably thinking through how are you going to be in a new age of artificial intelligence in our field, and even if not in our field, in your life and in the lives of the people that you serve.